Thank you for listening to Depictions Media Radio.
Hola a todos y muy buenos días.
Hello, everyone. Good afternoon from Washington, D.C. Thank you for joining us for today's press briefing of the Pan American Health Organization on the COVID-19 pandemic in the Americas. I am Sebastián Oliel from the Information and Communication Department of PAHO. We will be with you and will answer questions till the end of our session. You will be able to ask us question live and also through the Q&A button. Please always remember to include your name and medium when you write your questions. We have simultaneous interpretation into English, French, and Portuguese and Spanish, and you can click on the interpretation button on the menu that you have at the bottom of your screen. Today, Dr. Carissa Etienne, Director of PAHO, will be reporting about the epidemiology of the COVID-19 pandemic in the Americas and the vaccine status. With Dr. Etienne, we have Dr. Jarvis Barbosa, Assistant Director of PAHO, Ciro Ugarte, Director of the Health Emergencies Department of PAHO, and Dr. Sylvain Eldigueri, Incident Manager also of PAHO. Now, I would like to turn it over to Dr. Carissa Etienne to share her words with us.
A very good afternoon to each of you, and thank you for joining today's press briefing. Over the last week, over 1 million people became sick with COVID-19, and 34,000 died as a result of the virus. A few days ago, the United States reached a tragic milestone. More than 500,000 people have died from COVID complications. These losses are a profound reminder of the pain and suffering that this virus has caused, particularly in our region. Just 1 year ago, Brazil reported its first COVID case, and since then, more than 10 million Brazilians and nearly 50 million people have become infected with the virus in the Americas. That's roughly the entire population of Colombia. It's undeniable that the Americas have been the epicenter of this pandemic for months, and we continue to be disproportionately impacted by the virus. So while news outlets are reporting major declines in COVID-19 cases, I want to emphasize that we are certainly not out of the woods. The data tell a much more complicated story. The drop in cases in our region has largely been driven by dramatic reductions in new infections in the United States, where COVID cases and deaths dropped around 30% in the last week as compared to the previous one. This is a result of several factors, including tighter public health measures with higher public adherence and better coordination across the country, and of course, vaccine rollout. The US is not alone. In South America, most countries are reporting a drop in new cases. Nowhere have reductions been more dramatic than in Uruguay, which saw record high infections late last year and quickly implemented public health measures to control the virus. Within a few weeks, Uruguay managed to bring its outbreak under control. Brazil, Colombia, and Ecuador are also witnessing a smaller decrease in new cases, around 4% lower than last week's numbers. But the virus continues to spread at levels roughly equivalent to those that we saw mid last year, when many countries were sounding the alarm. Although we are better equipped to deal with COVID infections than we were 6 months ago, A lot can happen in a few weeks' time. Some countries in the region are still reporting a rise in infections. Peru is experiencing new outbreaks along its Amazonian border with Brazil and Colombia. In the Caribbean, smaller islands like Barbados, St. Lucia, St. Vincent and the Grenadines, and the Turks and Caicos are reporting a rise in new infections. To control the virus, we must remain vigilant and committed to the public health measures that we know are effective, especially as new variants circulate in the region and may increase the burden on our health systems. And that is why PAHO continues to monitor the virus's spread in our region for any changes in transmission, and why countries must continue to practice social distancing, mask wearing, and avoiding mass gatherings. As of this week, nearly 78 million people have been vaccinated against COVID-19 across the Americas and the Caribbean. With more people protected every day, the vast majority in North America. But it will be months before we see vaccinations impact the rate of COVID infections, even in places like the United States, where immunization campaigns have been active for weeks. In the short term, available doses remain limited, and we must focus on saving lives by prioritizing those most vulnerable, like our health workers, the elderly, and people living with pre-existing conditions. As the supply catches up with demand, we will be able to protect more and more people and rely on vaccines to ultimately control the pandemic in our region. For this reason, we need to maintain the measures that we know that can protect against the transmission. And I want to repeat, like wearing a mask in public spaces, keeping physical distancing, and avoiding crowded and closed spaces. Increasing access to COVID-19 vaccines in the Americas should be a top global priority. Our region has been hit harder by the pandemic than any other, and millions remain vulnerable to infection and death. Some 28 countries and territories have started delivering COVID vaccinations in our region after securing bilateral deals with manufacturers or receiving small donations from other countries. But this is not enough, and it is not acceptable. The life-saving power of vaccines should not be a privilege for the few, but a right for all, especially the countries at greatest risk, like those in the Americas, who remain the epicenter of the pandemic. Our region needs vaccines as soon as possible and as many as possible to save lives. Our recent development offers a glimmer of hope. One recent development, offers a glimmer of hope. Countries that are lined up to receive early doses from COVAX were notified about their upcoming shipments. This is really something to kindle much hope. Hundreds and thousands of doses will be delivered in the next few weeks. Supplies remain limited, and the COVAX deployments will be small at the beginning, but they will ramp up every month. Initial distributions to countries in our region will cover around 2 to 2.5% of the population, and they will be distributed fairly and equitably among participating countries. PAHO's revolving fund has been leading efforts to purchase vaccines on behalf of countries in the Americas. For months, we have negotiated directly with manufacturers to streamline agreements on behalf of the COVAX mechanism and to reduce the burden on national health systems. Despite the steps being taken to deliver vaccines as quickly as possible, we are still way behind where we should be as a region. And that is why we are urging the global community to make COVID vaccinations in the Americas a global priority, as it is where the need and risk are greatest. Our region has been hard at work so that once vaccines are approved and available, countries are prepared to roll them out and people are there to take them. And we are ready. As COVAX gears up to deliver its first doses, I also want to remind everyone that these vaccines are safe and effective. Every vaccine distributed by COVAX has undergone a thorough evaluation by WHO and many by stringent national regulatory authorities, which reviewed data from every step of the developmental process. This approval process is complex, rigorous, and thorough, so that citizens receiving vaccines can trust in their safety and efficacy.
Creo que estamos teniendo unas dificultades técnicas. Doctora Etienne, a ver si podemos continuar. Disculpas.
We apologize. We are having technical difficulties with the Dr. Etienne's microphone.
I'm sorry. So as we have witnessed the vaccine development process unfold, many of us have been absorbed in vaccine news and can recount efficacy data as if it was the score of last night's ball game. And while it is encouraging that the public has taken so much interest in science, we should exercise caution because the science behind each trial differs and vaccine efficacy numbers are being compared totally out of context. Although each vaccine is unique, those authorized for use by WHO and delivered through the COVAX facility have proven to dramatically reduce the chances of severe COVID infections. So this means that people who take them will be safer and in turn keep our communities protected as our health systems care for fewer COVID patients. So please, when it is your turn, we encourage you to please get vaccinated. Together, we have witnessed the overwhelming positive impact of vaccines on patients and communities alike. Indeed, through the power of vaccines, our region, the Americas, has eliminated smallpox, polio, rubella, and measles, and congenital tetanus. With COVID-19, it is no different. Safe and effective vaccines will help us turn the tide of this pandemic, but only if we can reach those most vulnerable, no matter where they live or who they are. And we will still need to maintain the proven public health measures of testing, contact tracing, quarantine, physical distancing, hand hygiene, and the wearing of masks until the pandemic recedes.
Muchas gracias, doctora Etienne. Vamos a pasar ahora entonces a las preguntas que nos han enviado.
Thank you, Dr. Etienne. Now we will go over to the questions, and we thank you for your questions. You can write them on the Q&A, and you please tell us your name and the medium you represent. We have a question from Agencia F. Macarena Soto. What do you think about the rate of vaccination in Latin America and the need that the vaccine should reach all developing countries? Dr. Etienne.
So far, COVID-19 in the Americas have brought the largest burden of cases and deaths. And we have been hit the hardest. And COVID-19 remains relentless. As we have said, on Monday alone, the region of the Americas has reported 50% of new global cases and 65% of new global deaths. Of course, I'm sure you agree with me that this fatality rate is too high. There are too many hospitalizations, overwhelming health systems across our region. The high high death toll is causing suffering in every nation of the Americas. And without doubt, it will have lasting repercussions for our families, our societies, and our economies. And that is why we need to address it now. Really, the best way to cut preventable deaths by COVID is by quickly deploying vaccines to those who are most at risk. But we need more vaccine doses as soon as possible and as much as possible. Let me say that we are very concerned about the limited supply that is available to middle and low-income countries in this region of the Americas. PAHO calls on our member states, the global partners, and regional institutions to do all that is in their power to increase the vaccination rates in our region. We will work with you to procure, deploy, and scale up. But we can only do this if more doses are allocated to our region. Many countries have started vaccinating, but several others have yet to deliver a single dose of vaccine. Only about 13 million in Latin America and the Caribbean have been vaccinated. But even in countries that have started, the vaccine supply has been slow and unreliable. Indeed, we are encouraged that COVAX vaccine deliveries will start soon in the Americas. And let's face it, this is a first step to change the lack of equity that we've seen so far. But believe you me, it needs to be increased and sustained quickly if we are quickly going to overcome the death and mortality.
Doctor Etienne, perdón, perdimos un minuto.
Dr. Etienne, could you repeat the last part, the last a couple of sentences, because we had again a problem with your microphone.
In the Americas, so vaccine deliveries will start soon in the Americas, and we are grateful to COVAX. But this is only a first step to change the lack of equity that we have seen so far. And it needs to be increased and sustained quickly if we are going to successfully confront the death toll and the misery that this is causing to the peoples of our region.
Muchas gracias, doctora Etienne. Siguiente pregunta.
Thank you, Dr. Etienne. We have Gisela Salomon, Laura Saravia from NBC News, and Melina Ochoa from Uno TV in Mexico are asking if COVAX has given distributions about the shipments of COVAX to Latin America and the dates, the amounts, the countries. When will this first shipment arrive and to what countries? And Gisela Salomon asks the status of the pilot plans with Pfizer vaccines. Dr. Barbosa, please. Thank you very much. Many questions. And let me clarify what COVAX is. COVAX is a facility which is innovative, which tries to guarantee equitable access of the countries to vaccines against COVID-19. COVAX is led by 3 international organizations, the World Health Organization, the Alliance for Vaccines, Gavi, and a platform of development of tool which is called SETI for emergent diseases. So these 3 are the leaders of the mechanism of COVAX facility. WHO is in charge of establishing the policies for assignment or allotment of vaccines. And we, as the office of the WHO in our region, we contribute with the information for decision making. Gavi generates the COVAX facility, and CEPI is supporting the development of new vaccines against COVID-19. Vaccines are purchased through 2 mechanisms. The revolving fund, the PAHO's revolving fund, vaccines revolving fund, we will be purchasing vaccines for the countries of the Americas. And for other countries in the world, UNICEF is the one that is in charge of purchases. So all the countries in our region received a letter from the COVAX facility about 2 to 3 weeks ago informing them about what would be the estimate about the amount of vaccines that they should receive during the first semester of this year, the first half of this year. And now COVAX is finalizing negotiations with a manufacturer. It is a very complex negotiation because it involves the government of the country where the manufacturer is located, and you need to get waivers for exports, and this is what is pending, so that the COVAX facility can then send letters to each one of the countries with a final estimate of the vaccines that they will be receiving from the two AstraZeneca manufacturers, the one that is located in India, which is the Serum Institute in India, and the AstraZeneca manufacturer located in South Korea, which is SK Biosciences. So in about 2 to 3 days, the countries will be receiving the letters. We at PAHO are working every single day to finalize agreements with the manufacturers that will be sending vaccines to the region. Today, we finalized the negotiation. It was very complex with many details of everything related to the manufacturers, and we think that COVAX will be able to fulfill its promise to be able to deliver vaccines in March. And at the end of February today, COVAX sent its first delivery to Ghana. Ghana was the first country to have received vaccines from COVAX. So at this point in time, where there is a very limited supply of vaccine, even for rich countries that have purchased many vaccines, they're not receiving the number of vaccines they purchased from the manufacturers because some experienced production problems. Others sold more. They oversold themselves more than what they could deliver. Others are having problems with waivers and release for export purposes. So for several circumstances, we as the revolving funds have been working daily with the manufacturers to be able to complete that very challenging process, and we expect that the countries in Latin America and the Caribbean will be receiving COVAX vaccines on the dates that were promised during the month of March. All countries will be receiving vaccines produced by AstraZeneca in in South Korea and India. Thank you, Doctor. There are other questions. Marta Costarec from Conta Replica, and Marie Martinez from El Sol in Mexico. And there are other questions. They ask, or they say, Mexico, through their foreign minister, have expressed their concern to not having an accurate date for the reception of COVAX vaccines. So what can you tell us about when vaccines are going to be delivered? Yes, thank you. Thank you for your question. We understand and we share the concern by all. We want vaccines to arrive as soon as possible. During the first phase, as our director also underlined, we want to maintain the health services to keep on working, save lives by protecting then health workers, the elderly, and those who have conditions that bring about a great risk if they were to become infected with COVID-19. So this is the process, not only with Mexico, but with the rest of the countries. And I know Mexico and all the other countries are expectant, waiting to see the different developments that are being carried out in the countries, and COVAX will begin with deliveries in March. Even countries that established bilateral agreements with the manufacturers are having trouble receiving doses of the vaccine. And we need to be very clear here. The vaccines are limited in number. The more bilateral agreements are made, the more availability will decrease. And so having a mechanism such as COVAX, a facility like COVAX that can deliver vaccines equitably is a great advantage for the whole world and for strengthening this mechanism. Thank you, Doctor. From Blanca Valadez, Millennium, Mexico, and it says, we have identified UK, Brazil, and South Africa variants of the virus, and there's the idea that there is even a new variant that has emerged in the country itself. Dr. Aldigueri, can you please answer this question? Thank you, Sebastian. Thank you for the question. From Mexico, Mexico has systematically reported the variants of SARS-CoV-2 variants of concern confirmed by INDRE, which is the diagnostic and reference lab. PAHO has received a report from Mexico of the variant initially detected in the UK. Also, the P1 variant initially detected in the Amazonian region of Brazil, but we don't have confirmed reports by the national authority of the variant it initially detected in South Africa. Again, those variants which are of interest and concern because they have some mutations are disseminating throughout the planet. By February 22, that is last Monday, in the region of the Americas, 25 countries and territories had reported at least one of the three variants that are being followed at global level. In other words, the capacity for quick transmission at regional level and as well as spread in other regions, as for example in Europe, means, or I would like to emphasize that it is important to ensure that there is genomic surveillance which is focalized for emerging patterns. First, the variant which was detected in the Amazon basin followed the same kind of transmission seen in the state of Jalisco at the end of January of this year. It is important to emphasize and remember that appearance of variants is an expected phenomenon which has to do with the biological evolution of the virus, and worldwide laboratories and regional laboratories are currently studying and every month they see more differences and particularities in the virus, but there are other higher interest variants, which we have mentioned and were mentioned by the question from Mexico. And these the different behaviors are rarer. So to conclude about the question on Mexico, we do not have information about the potential emergence of a new variant of greater concern and interest in Mexico. I hope I have answered your concerns to the person who asked from Mexico. Yes, thank you. From Claudia Torrens from AP, and I would like to ask Claudia to please ask her question directly. If you're listening, you're on. Over to you, Claudia.
So I am giving you the floor now. Yes, good afternoon. Thank you very much. So the president of Argentina yesterday asked Mexico to join them in their proposal for the COVID vaccine to be considered a global good, and also for countries to be able to, any country to be able to produce it. Is it feasible? What does PAHO think about it? Thank you, Claudia. Dr. Barbosa, could you please address this question? Thank you for that question, Claudia. There are some international agreements, such as the Doha Declaration, whereby the protection of intellectual property should also take into account the needs of public health. This is an old debate that has been taking place among the countries for many years, and it is important that a position such as this one by Argentina and other countries in the region to consider such an important tool as vaccines are as a global good. I think that this is a very important concern. And from a pragmatic point of view, I think that the best approach we can have is a call for international solidarity so that countries can come to an agreement so that the COVAX facility, that is the facility that does have the objective to attain equal distribution, could have more vaccines, because the producers could also refer to their intellectual property rights, and it is going to take months or years for those countries to have the technology necessary to produce the vaccines. So I think that we need to maintain this conversation at the global level, but from a pragmatic point of view. More vaccines should be available for the equitable delivery system that COVAX has, and this would be a very important step to guarantee that the vaccine indeed is not for the market, but it is an important tool to save lives and also to support the response to this pandemic. Thank you. Thank you, Doctor. The next question is by Nicole Chapur from Bloomberg in Venezuela. She is saying that the advisor to the National Assembly, led by Mr. Guaido, indicated that the arrival of the vaccine to Venezuela through COVAX would take place in April or May because of red tape and the blockage on the funds. She is asking whether we agree on this deadline and what progress has been made for access, faster access to the vaccine through COVAX, and whether you agree on the way the vaccines that arrived last week to the country were applied. Dr. Barbosa, could you start answering this question? Yes, thank you. And I am going to ask my colleague, Dr. Ugarte, to supplement my answer. In order to receive the vaccines, the countries do need to implement various measures, such as the regulatory aspects for the vaccine to be able to be imported into the country and be administered, also to prepare all of the importation mechanisms to improve their work with the producers. So each of the countries in the Americas are receiving support to be able to receive the vaccine when the producers are ready to send them. This is a project that we are supporting throughout the countries, including Venezuela. Venezuela has had some difficulties having access to the funds, but we are supporting the Ministry of Health of Venezuela with all of the aspects so that they can have their vaccination plan, and also to have all of the legal, administrative, regulatory measures for cold chain, to have everything ready for the arrival of the vaccine. And yes, we are deeply concerned so that no country in the region is left behind. And this is important. I would like to invite my colleague, Dr. Ugarte, to supplement my answer. Thank you, Dr. Barbosa. Regarding the progress made by the technical table has met twice already. The second time it defined the inclusion of, for example, the National Academy of Medicine, scientific associations, and also other international actors to review the vaccination plan for COVID-19. And it was decided that on February 25th, tomorrow, a working meeting will be held with the government, the opposition, UNICEF, PAHO, and other actors to share the progress made with the vaccination plan and also to request contributions to improve it. As to the implementation of the 100,000 doses of Sputnik 5, the Ministry of Health reported to the technical table as to the delivery of those doses, and they indicated that it follows the guidelines to administer the doses to frontline workers, about 12,000 of them, and the vaccination strategy, including also vaccination stations at the various reference health clinics. All of this is in accordance with the plan that has already been established, and also the idea is to continue monitoring the process to make sure that the technical and operational guidelines are being observed, and also to introduce the adjustments whenever necessary for that vaccination to be in accordance with the guidelines. Thank you. Thank you, Doctor. The next question, and here I'd like to give the floor to Claudia Luna Valencia, who is with W Radio in Mexico. Claudia, please go ahead.
Hola, ¿me
Can you hear me?
Hola,
Yes,
muchas
please, go ahead.
gracias.
Thank you very
Fundamentalmente son
much.
dos preguntas.
I
Estamos
mainly
viendo
have
que ya en
two
diversos
questions. We
países
see
se
that
está
in
hablando
various
de una
countries
cartilla
they are
verde, como en
already
el caso de
referring to a
Israel,
green
para
card,
que
such
aquellas
as in
personas
Israel, for
vacunadas
those
vuelvan a los
vaccinated
gimnasios, vuelvan
individuals
a
to
los
go back
espacios
to the
públicos.
gyms
En
and
Reino
public
Unido también se está
spaces.
hablando
In the
quizás de una
UK, they're
especie de
also referring
pasaporte
to some
sanitario.
sort of health
Me gustaría saber
passport.
esa
I'd
opinión
like
por
to know
parte de
what your
ustedes, esa
opinion
postura
is in
al
connection
respecto
with
de
that
un
position
posible
to have
pasaporte
a
sanitario que vaya
potential
extendiéndose en los demás
health
países en la
passport to
medida
be
que la gente
used
va
in other
vacunándose.
countries
Y
also
por
as
último,
people become
en
vaccinated. And
Galicia
also
ayer se aprobó en el
in
Parlamento
Galicia,
una ley que
Parliament
aquí en España pues ha
yesterday
causado
approved a law that
bastante,
in Spain
pues ha
has
llamado mucho la atención. Esa ley
been
que se ha
quite
aprobado
striking.
tiene
The
que
law
ver con
passed
multas
has
a
to
partir de
do
1.000
with
euros a aquellas
fines
personas que se nieguen a
starting at
vacunarse.
1,000
Es una
euros for those
obligatoriedad
who
que han
do not
dicho que
want
no
to
la
get
van a implementar en
vaccinated.
este
This is
momento,
mandatory.
pero
They
que
are
de
saying
ser
that they are not
necesaria
going to
la
implement
pondrían
this
en
now, but
práctica.
if
También conocer
necessary,
su opinión.
they would
Muchas gracias.
implement it.
Saludos.
And I would like to know what you have to say about it. Thank you. Dr. Barbosa, could you please address the question? Thank you. Thank you very much for your question. I believe that first, in connection with the passports, this is a discussion that goes back to the beginning. Some countries referred to a passport for those individuals that had had the disease. And back then, and also now with the vaccine, we need to be extremely careful as to what the objective is behind a passport of this sort. I think that the most significant objective would be to implement their immunization, their vaccination plans to comply with the requirement to vaccinate priority groups and then to extend vaccination to attain the minimum of 70% that we believe, once again, we believe because we need actual data, that could be the necessary level for vaccine coverage to give us herd immunity. So I think that we need to be very careful with the ethical aspect, not to have a barrier for those individuals, for example, that need to work and cannot do it because they do not have their passport. We also need to look into the international health regulations that establish what the only vaccine it is for those countries that require, for example, vaccination against yellow fever. So we also need to look into the technical aspects so that it doesn't become a barrier to the vaccine. As to fines, I am certain that this is a decision to be made by each of the countries, and I believe that Every country is familiar with their own rules and with their own situation. The vaccine has to be, again, for the population that needs it, and it has two important roles, as our director has mentioned. First of all, individual protection. Medical staff that has been vaccinated will continue to be able to work at the hospitals and also in ICUs. The elderly and individuals that have chronic conditions that are and who are vaccinated will be protected against the severe forms of COVID-19, and they will be protected against death. But also the vaccine has a collective role as coverage. Vaccine coverage is expanded, and unfortunately with the low availability of vaccines in the world, this is going to take a couple of months, and that collective role will be the role of protecting individuals, all of the individuals and the population, and make sure that the epidemic can be controlled. So I think that more than an obligation, I would say that this is a right that individuals should be aware that they need to have this right to protect themselves, to protect their families and the communities. So the information regarding the safety of the vaccines and also how the vaccines worked, all of that is a greater stimulus, for example, for someone as compared to any other measure. Thank you very much. Thank you, Doctor. The next question is by Giovanni Schiffman from La Prensa in Nicaragua. He is asking whether the delivery of the first doses through COVAX scheduled to start in March would lead the governments to implement some communication measures, and which ones would those be for the communication, and also whether the plans include any management of adverse reactions, and whether it would be necessary to have campaign to generate trust among the population. Dr. Ugarte, this is a very important question. We might have the proper preparation. We might be implementing the plans and also activating all of the mechanisms, but the right response is that there is no proper communication to the population. Therefore, the message is not conveyed as it should be. And it is necessary also to highlight this piece of information, not only how the pandemic is evolving, but also the protection measures, the arrival and the deployment of vaccination. Transparent, timely information, sufficient information is very important for the population to be part of the response. In connection with this issue, PAHO drafted a guideline for those countries to develop a strategy to communicate risks on the COVID-19 vaccine. And this is a communication that I invite you to review, because there you will see very specific guidelines and practical guidelines as to how to address the various aspects of vaccination from the operational point of view, but also from the point of view of the measures to be implemented when immunization takes place, as well as the definition of the priority groups, and also how the population, as Dr. Jarvis just mentioned before, how the population should behave after the administration of the first, the second doses, and how that measure should be maintained in the long term. So the aspect of communication is one of the cornerstones of the COVID-19 response. Thank you. Thank you. Now I'd like to give the floor to Katin Joseph, Health Editor.
Observer Media in Antigua and Barbuda. Katim, if you're listening, you have the floor.
Thank you so much. I am here indeed. So my question is for Dr. Etienne, and it surrounds the WHO and one of the recommendations they have made. WHO has said that while individuals who may have contracted COVID-19 can be vaccinated, they should wait until the course of illness has ended. Does this mean that people should be tested before COVID-19 vaccines are administered to them? And if not, are there any evidence, or is there any evidence that the administration of the COVID-19 vaccine, whilst having the illness, can cause adverse effects?
Sorry. Gracias, Karim. Doctor Barbosa, como nuestro experto que está llevando este tema, ¿podría usted contestar?
Yes, thank you for your question.
Would you like to address it, Dr. Barbosa? You are the expert.
The recommendation is that the people that have COVID-19 should get vaccinated. Why? First, because we don't know how long is the protection provided by the natural infection. Second, some people may have received a false positive test result, and they may think that they are that they had the COVID-19, and really they haven't had. So they need to be vaccinated. The vaccination needs to be implemented following the priority groups. So if you have a people who has hypertension, diabetes, or is 80 years old, even in the situation that this person had COVID-19, it's very important to guarantee that this person will be protected with the vaccine. About this question, if you should have a test before the vaccine, from a public health perspective, it is not feasible. Just because some people may have antibodies and not being detected precisely by the test, and the cost to test everybody, because many people can have had a mild infection, so it's not feasible. It's better to guarantee that the priority groups, the most vulnerable population, they should get vaccinated, even in the situation that they had or they think that they had a COVID-19 infection. Thank you for this question.
Gracias, doctor. Tenemos varias preguntas.
Thank you for you, doctor. We have several questions by journalists in Venezuela, Nicaragua, El Salvador as to the delivery of the vaccines and when the first batch is expected. Ana Lucia from Nicaragua, Medina Ochoa from Mexico, Mariana Barrio from Venezuela, Uriel Velázquez from Nicaragua, Despacho 805, and also from Romero from El Confidencial Nicaragua. They are all asking about this, Dr. Barbosa. Thank you. Thank you for these questions. I think that these are a lot of questions, but in truth, we have two questions that are concerning individuals. One has to do with the number of vaccines that the countries are going to receive. It is important to clarify that each country at the beginning last year, when they decided to be part of COVAX, presented a request. Some countries requested vaccines for 10% of their population, others for 15%, and others for 20%. So each country will receive throughout the year, throughout 2021, the number of vaccines that they have requested for the COVAX facility. The first vaccine deployment to be done by COVAX is the following. There is a group that is a group from WHO that makes the decisions, and that group strives to have equitable criteria, and the countries are going to receive, as part of the first deployment, an amount that is between 2.2 and 2.6 of the population, 2.2% or 2.6%. The countries will be receiving a letter, and we hope that this is going to take place during the next couple of days. And we have a pending agreement between COVAX and the producers trying to determine the specific amount for each country. The exceptions are those countries that have a small number of the population. For example, some Caribbean countries are going to receive in the first deployment vaccines from AstraZeneca, from two producers, AstraZeneca from India and AstraZeneca from Korea. They will be receiving up to May that number, 2.2 up to 2.6% of the population. For example, in some of the smaller islands of the Caribbean that have a small number of inhabitants are going to receive a higher number, up to 20% of their population. That is why, since this is a very small deployment, the cost for shipping small amounts is very high, and for small numbers are going to, whenever we're talking about small numbers, this is the effect we're going to have. This is a decision made by WHO, and the number keeps repeating itself, when and how many. And as to the access, this is not a decision. This has to do with the actual situation in the market. It is a very strong, very difficult negotiation with the producers about the amounts available, how it will be shipped to each of the countries. So if there is a decision, the decision is to send the vaccines as early as possible, and there we rely on the negotiations carried out by the COVAX facility for the producers for the vaccine to arrive as soon as possible in the month of March in some countries, and for some countries in late February. Thank you very much. Thank you. The next question is by Anui Gallo from Radio Corporación in Nicaragua, and he is saying that the government is reporting on the COVID situation on a weekly basis. For example, 47 individuals obtained the disease or got the disease, and one person died the week of the 16th of February, and they are asking whether the country is reporting the same data to the organization, or if they maintain the same data about 40 to 50 deaths. Yes, indeed, PAHO receives the same information through the channels of the international health regulations. This is a response that is shared publicly. This is the same information that is received by PAHO through the international health regulations. Thank you, Doctor. The next question is by Mariana Suquet from Efecto Concuyo in Venezuela. She's saying that in Peru, Chile, or Argentina, there has been some controversy surrounding the vaccination of officials before vaccinating other priority groups. What is PAHO's opinion, and whether this is an ethical situation? Dr. Barbosa. Thank you for that question. The role of the World Health Organization and the Pan American Health Organization is to establish the technical recommendations for each country to make their own decision based on their own national situation in connection with the availability of the vaccine and other national aspects. Our recommendation to the countries based on the evidence we have is that this vaccine has to be used first to maintain services, health services, as well as other essential social services operating. So health workers are the first to be vaccinated, and other individuals, for example, that work at homes that care for the elderly, because that is the door for the virus to go into nursing homes, for example, and that should be the first group to vaccinate. So health workers and also other frontline workers. Then we need to vaccinate the elderly and individuals who have chronic diseases that may also present a risk for the development of severe forms of the disease. So the vaccine will be used to protect the most vulnerable groups that could develop serious manifestations of the disease. And as more vaccines become available, the population should be vaccinated based on groups until we attain a coverage higher than 70%. That is the minimum expected to be necessary to control the epidemic. So The decision is a decision to be made by each country, but in general terms, it is very important for the countries to follow those technical recommendations, and for the communication to the population is as transparent as possible. We are at a point in time when there are great discussions behind the vaccine, and this is another difficulty. We already saw this during the pandemic. So they need to have transparency to convey their plans. They are trying to determine what is the strategy, what is the plan to be used, and I think that this is undermining the trust of the population in the measures implemented by the ministries of health. They need to be clear for a vaccination campaign to have the strength it needs. Thank you. Thank you, Doctor. The next question is by Alina Diese from AGP. She's saying that Cuba is expecting to become the first Latin American country to produce its own vaccine against COVID-19. She's saying that the sovereign dose, the one that is the most advanced out of the 4 experimental vaccines, is being considered, and her question is, what does PAHO think about Cuba's efforts to have its own vaccine and about the progress made so far? Thank you very much for the question. It is important for the countries in the Americas and in the Caribbean to be able to see how to diminish the vulnerability with CTD in this region to the production of vaccines, medicines, and also personal protection equipment, respirators, and other devices to control the pandemic. As I mentioned at the beginning, the 3 pillars of this response are the COVAX facility that is led by Gavi, the cornerstone that has to do with the work conducted by WHO, and there is also a support pillar for research that is led by CEPI. We do have information of some of the projects underway in the region, including this one in Cuba, and we also support how we can put the producer in Cuba in contact with CEPI, and also some other projects in Brazil, so that they can avail themselves of some resources that CEPI can offer them for the preclinical and initial stages of the vaccine development. The Cuban vaccine, based on the information we have, is soon to enter phase 3. That is the final stage in the clinical trials, but it is this phase that takes the longest, because the thousands of people need to be vaccinated and wait until a specific number of people have already been infected, so that the efficacy of the vaccine can be analyzed. So this may take a couple of months, and we believe that as the more vaccines can be developed, the better. And to participate in the COVAX facility, the vaccines need to comply with the same criteria. They need to be pre-qualified, they need to be pre-authorized for emergency use by WHO. Today, with that authorization, we have the Pfizer vaccine, the 2 vaccines by AstraZeneca that I mentioned, the one that is produced in India and the other one that is produced in South Korea. The Moderna vaccine is in the final stages of analysis, and we also have Sinopharm, a Chinese producer, that also requested evaluation as part of the work conducted by this working group. Also, the Janssen vaccine is being assessed. All of the producers are welcome. It is very important to have many producers so that they can provide the vaccine that the countries need, but they all need to comply with the certification criteria, as well as safety and efficacy. Thank you, Doctor. We are reaching now almost the end of this media briefing, but we have a question by Roston Jones from 8 Witness News in Bahamas. I'd like to give the floor to Royston.
You have the floor, Royston.
Good afternoon, and thank you so much for taking my question. In the Bahamas at the moment, the government has announced that it will use the 100,000 doses of AstraZeneca that we expect to receive by week's end to provide a first dose to 100,000 people in country. So 100,000 doses will be used to provide the first dose. I want to know what PAHO makes of this approach, and given the demand, though the supply shortages, if there's a delay in getting that second tranche of vaccines, what position could the Bahamas be in terms of protection of those people who receive a first dose? I believe the recommended time between doses is 12 weeks. So if we go well beyond that in terms of getting the next tranche of doses, what position does that leave those people who take the first dose? So what does PAHO make of this approach, please?
Thank you, Royston. Doctor Barbosa podría contestar.
Yes, thank
Dr.
you
Barbosa, could you answer?
for this important question. See, when one vaccine is authorized by WHO, this vaccine also is assessed by the SAGE. SAGE is the acronym for the Strategic Advisory Group of Experts on Immunization. This is a group that makes all the recommendations for WHO about all the vaccines that WHO recommends to the countries. Here in our region, we also have a technical advisory group on immunization that provide advice to PAHO and to our member states. With the information that was provided by the producer of this vaccine, AstraZeneca, the second dose should be given up to 12 weeks after the first dose. This is the data that we have, so this is the recommendation. I don't know the details of the announcement by the government of the Bahamas, but let me tell you that one important characteristic of the deployment through COVAX is sustainability. So the countries will receive the information not only for one deployment and nobody knows when the second is coming. They will receive the information about the deployment that will be released to the countries up to the proportion of the population that the country has requested to COVAX. With this information, the country can make their decision, can make the prioritization of the groups, can start implementing the national plan for development of the vaccine. So with the information that we have now, in summary, 12 weeks is the best period, up to 12 weeks is the best period to give the second doses. And with the information that will be provided by COVAX, the Ministry of Health of the Bahamas will make the best decision about the use of these vaccines, having the information not only for the first deployment, but for the second, for the third, so they can plan the deployment very well. Thank you.
Gracias, doctor. Ahora sí, la última pregunta.
Thank you, doctor. Now we have the last question for today's session. This is a question presented by several journalists. They are asking whether PAHO is concerned about countries not being able to implement their vaccination plans effectively and whether countries are ready to apply vaccines when they arrive through COVAX. Dr. Etienne.
For this question, which is important within the context of rolling out as fast as possible. Let's remind you that PAHO has been working with our member states for months to help them prepare to roll out vaccines. And let's not forget that this also builds on decades of experience with robust immunization programs and an extensive network that gets vaccines delivered even in the most remote areas. If any region can do it, our region has that experience. So in preparation for this deployment of COVID-19 vaccines, our member states have gone through a long evaluation and readiness process to make sure that they are ready. And this has been especially thorough for the countries that are part of the COVAX AMC and will receive vaccine at no cost. And PAHO has reviewed with our member states those assessments in terms of readiness. And I honestly can say that our region is ready. In Latin America and the Caribbean, countries are eager and prepared to scale up immunizations quickly. Of course, we know that this will be a different campaign than our normal childhood immunization campaigns. So, of course, they will have to use and to adapt their different strategies and adapt their past strategies. So, we know that there will be challenges, but I am also confident that we'll overcome them, as we've done so many times before. Now we need to get enough vaccines to those most at risk of infection or severe diseases. And that's important for us. This will help us protect our health workers and reduce mortality. Especially in the beginning, while supplies are severely limited, focusing immunization on those most at risk will help us have a real impact on mortality. Our objective in the initial phase is to save lives. But this needs to happen in every country. As soon as we reach coverage of health workers, the elderly, and those with underlying conditions, countries will have to scale up. And PAHO commits that we will be with every country every step of the way, from procurement to delivery, until we are able to control this virus in our region. Thank you.
Muchas gracias, doctora.
Thank you very much, Dr. Etienne. Now we have reached the end of today's session. Next week, we go back to our...
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.